part of introducing myself because ma'am has done it pretty well. But I would still like to tell you that I'm from Delhi and I had been conducting various workshops on rubber damology or rotary endodontics, magnification in Delhi NCR. Then I shifted to Indore, the cleanest city of India, and where I got married. This is my workplace. And then I had been doing different workshops. I opened my own academy. So even today, what you will be learning, you can get a hang of it at my own academy. So where I have conducted various workshops in past 1 year and on some on-demand workshops as well. So you can get all the updates regarding them. My two most classical workshops are on rotary endodontics, where I go from basic to advanced. It is an evidence based and a clinical update, which is a rotary endodontic workshop, which is called Endoveda. And another is Endoneve, where what I believe the foundation for your restorative work or your endodontic work is a use of rubber dam. So Endoneve, that is the reason, and rubber dam as an Endoneve is basically rubber dam workshop. My next workshop is in the Feb this month only. All the updates regarding workshops and everything, or even webinars, you can get on these my professional Instagram profiles. So what I believe is learning is a continuous process. So you can learn from anyone at any time, and whatever you are learning, you will always be grateful for that. So with that thought only, let me begin with my today's presentation. So we are here on Sunday because we want our endodontic outcome to be successful. So there are 4 A's that we should stick to when we are performing a root canal therapy. One is asepsis should be on point, like your sanitation, your disinfection should be on point. That is what we are going to discuss today. Your access should be proper because we don't want to miss any anatomy. Whatever cleaning we are doing is successful if your irrigant is activated well, and an educate seal once you have performed the root canal will give you a proper outcome. But what all endodontic success we need can be achieved with only one step, a most fundamental step that what I believe everyone misses in their practice is the inculcation of rubber dam in your practice. Once you are using rubber dam, you can achieve disinfection, you can have a proper access, whatever irrigant, whatever concentration, whatever volume you are using, you will be having a proper outcome. You will be achieving a proper bonding. But right now, the topic is not about rubber dam, but whatever advancements that we are achieving slowly in endodontics start at use of rubber dam in your clinical practice. Okay, I won't be telling you why rubber dam is important. You already know it is one of the most important parameter for the success. But the reason why people are not using, their n number of studies, the only reason I believe anyone who's not using rubber dam in their clinical practice is their own failure, or they themselves are stopping them, because rubber dam is very easy once you start using it, once you are able to overcome that learning curve. So whatever I'm telling you, all the advancements that I'll be showing you will not give you the result that you desire if you are not including rubber dam in your practice. Okay. So now what we are discussing today is cleaning of your root canal anatomy. First of all, the root canal anatomy is not a cylinder or a round or a tapering canal. It is very challenging and it is very complex. So complex in the terms like there are different anatomy. You have apical delta, you have recurrent canals, you have collateral canals, you have isthmus area. All these areas, these areas cannot be reached by your file. File system is important because we need to shape the canal, shaping so that your irrigant can reach, your irrigant can clean the canal, remove the biofilm. You can achieve a proper seal once you are obturating the system. So these shaping protocols or different rotary files are not able to reach in the complex root canal anatomy that remains untouched, because your file, either your hand file or your rotary file, is not able to penetrate these areas. So what do you call these areas? These areas are inaccessible areas. Why inaccessible? Because they are not accessible by your any kind of file, your hand file or a rotary file. So what will be reaching in these areas? What will clean these complex anatomies? Your apical delta, your recurrent canals or recurrent loops, or your isthmus area. What will be cleaning these areas? So the today's topic will be focusing on how these areas can be sanitized, how proper cleaning of these areas can be achieved, and what all system do we have. I'll be talking about a conventional system, a slow delivery system, and the new advanced and a negative pressure system. You'll get to know once we are discussing. So I have already discussed and taken a lot of lectures on disinfection, where I am telling you about the 3T protocols. I'm audible? I'm audible? I'm audible?
Yes, yes, ma'am.
Yes, yes, is happening, ma'am.
See, I want you to see this image.
Yes, Maika ma'am, please could you mute yourself?
Okay. I would be wanting you to see the image. Uh, we'll wait because I think there's some.
Yes, ma'am. Now you can
My voice
continue.
is clear now.
Yes, ma'am.
Yeah. See, uh, even if we are doing proper shaping, there are areas that are still untouched, uncleaned, inaccessible by your rotary files. So to clean these areas, even if you have performed a proper shaping, these areas need to be cleaned by irrigant. So now here I would like to ask you one question. Please mention in the comment section which is the most common irrigant that you are using at present. Nihar, could you please tell me what everybody is putting in the text box?
Sure, ma'am. Saline and hypo.
Okay, I'll be very
Saliva.
frank. Okay, if even if everybody is replying, okay, okay. See, if you are not using rubber dam, you'll understand why I'm putting my emphasis on rubber dam, because what all advancements we'll be discussing, this becomes your foundation. If you have not put a rubber dam, your patient at every step will be getting up and spitting. And once the patient is going back to your chair, your entire canal, your entire chamber is again filled with the patient's own saliva. So if you're not using rubber dams, then the most common irrigant that you are using is basically your patient's own saliva. So let us come on to the irrigant that we actually need. See, you need to put rubber dam. Even you need to disinfect your rubber dam with isopropyl alcohol. Okay. Now, it is completely clear, and I think almost all of you know the irrigant that we need is your sodium hypochlorite. Now, how do you need it? How do you, in what concentration you use, volume, and how do you activate? Everything we'll be discussing now, and also the sequence in which you need to be using it. Okay. So whatever irrigant we are using, we need it for two purposes. One is we need our pulp to be dissolved, to be disintegrated, our biofilm and microorganism to be removed, all pulp remnants to be cleaned. For that, we have sodium hypo, the gold standard. Okay, we have different alternate options that we'll be discussing. Then you need mechanical effect. The mechanical effect is just for the removal, for the detachment. Okay, even that we'll be discussing. And for that, you have your saline, you have your EDTA. We'll be discussing the sequence we need to use it in, the concentration, and the method. Okay. Now let us talk about sodium hypochlorite, which is the gold standard. So there are people, when we are discussing, like my root canal failed, even though I am using sodium hypochlorite. So how you are using your hypo? In what concentration you are using your hypo? Are you activating your hypo? Are you warming your hypo? If you go back to your like our final year BDS, we were told this thing that we need to warm, we need to heat the hypo. Now, why? How do we do that? What device we have to do that? We need to discuss that also. Now, another thing is concentration. Okay, the time for which your hypo is remaining in contact with your root canal wall, everything matters. It's not just that I have used sodium hypochlorite, my outcome will be perfect. No, what concentration, how you are using, everything matters. Okay, now let us see what are the factors that are pertaining to your hypo. I have already told you that we need to warm our sodium hypochlorite. At present, we are discussing our conventional or the slow delivery method for our 3D cleaning. When I say conventional method, I am using a needle. I am delivering my irrigant, either whatever it is, hypo or saline or EDTA, and it itself is coming back to the orifice, and later it is getting suction back. So this is our positive pressure irrigation system, which is our conventional system. Now, even in this conventional system, positive pressure irrigation, I'll be discussing few things, and I want you to think yourself what all I have already included in my practice. Whether it is in terms of the needle, you are using what gauge of the needle, what activation you are doing, or you are not even activating your hypo or other irrigant. So you need to think yourself, or you need to write down. Right now we are discussing the conventional method, that is your positive irrigation. So in terms of hypo, you need to heat the hypo, you need to activate. You have sonic activation system, you have ultrasonic activation system devices. You need to refresh hypo. Always remember, this is something very important that you will be able to relate once I'm telling you about negative pressure. Sodium hypochlorite is active for a very minimal time the moment it comes in contact with your tissue. जैसे ही हाइपो हमारे पल्प को टच करता है, उसको डिसइंटीग्रेट करता है, within few seconds, I'll say, it loses its ability to dissolve further. So you keep on need to refreshing the hypo inside the canal, your chamber. So this is something very important. And also the time and the duration for which it is in contact with your root canal system. So you have devices, you have devices that you can use to warm hypo within the canal. Also, there had been devices that there were equipments in which we used to keep our syringes with the hypo to warm the sodium hypochlorite. Now, studies they show your hypo is active. Its activity increases, its dissolving ability, its antibacterial activity increases only if you are doing intracanal heating. That is, you are heating it inside your canal, inside the chamber. So you can have devices like I use my downpack device for few seconds. Once I have put my hypo inside the canal, I put my plugger inside the chamber and heat it for few seconds, like 3 to 5 seconds. Then you have options like these brush files to activate your sodium hypochlorite, or you can use different chair side ultrasonic unit, or you have ultrasonic devices available from different brands. Also, you have sonic activator from Dentsply. You can use that also. Okay. So these are the methods. When you are heating your hypo, you are activating your hypo. Already I have put rubber dam, so I can use a higher concentration. Always remember, if you are using hypo at 5.25% concentration, your outcome would be better. Okay. Now you can heat your you can do the heating within the canal, and you can activate with different ultrasonic activation devices. And another thing, that when you are putting the rubber dam, most of the cases for the root canal we are doing, they are class 2s. So your if you have done a proper build up, pre root canal build up, which is your pre endo build up, what will happen? your entire pulp chamber class 1 cavity will act as a reservoir. So your hypo, there'll be continuous flow of sodium hypochlorite. We are having a fresh supply of your hypo, and then we have a reservoir where it can stay and nothing is getting inside the patient's mouth. So always make sure, first of all, you are using the right irrigant, which is your sodium hypochlorite. You are using it in right concentration, and you are using proper equipments, proper devices to do the intracanal heating for activation. Now, another thing, how many of you are still using your EDTA gel in your practice? See, if you are still using EDTA gel with each rotary file that you are using to shape the canal, the important thing is you yourself are making your rotary files susceptible to fracture. Now, studies they have shown that if you are using EDTA, we already know we are using hypo because pulp को dissolve करना है, pulp को eliminate करना है, bacteria को kill करना है. But why do we use EDTA? Why do we need EDTA? Because EDTA is not as impactful as your hypo in killing the bacteria. बायोफिल्म पे उसका कोई इतना इफेक्ट नहीं है. मतलब it is not destroying your biofilm. That is the function of your hypo. See, if you remember, we used to study about smear layer, when we were studying about composite. Whenever you are cutting or making a class 1 or a class 2 cavity, you are cutting the tooth debris are settling onto the tooth itself. That was your operative smear layer. Similarly, you have a smear layer in a root canal system, which is your endodontic smear layer. I am filing my canal, producing the debris that is settling on my on the canal wall. That debris is your endodontic smear layer. Now imagine I am activating my hypo. My hypo is still not penetrating into the dentinal tubules. Why? Because I have myself created a smear layer. So you need a liquid EDTA. Now, why we have switched from gel to liquid? Because gel is doing what? It is making my file more prone to fracture. So what I have done, I have switched from gel to liquid. Now I am using liquid EDTA in 17% concentration. And why I'm using EDTA? So that it will wash off this smear layer. So in the subsequent wash, I can use hypo to clean the deeper microorganisms that are present in the dentinal tubule. Another thing, you never use EDTA hypo sequentially because they react and they form precipitate. So you will always, why do we need saline? Saline is chemically inactive. It has no function. It has no role to play. It is not killing your bacteria. It is not dissolving your pulp. It is not removing smear layer. It is just used for wash off. Okay. So you are using hypo. You are using saline. You are using EDTA because you want the smear layer to be removed. Then again, you are using hypo because I want my hypo to go deeper. Now, for pertaining to hypo, what you are doing, you are activating the hypo, you are heating the hypo, you are using it in right concentration, higher concentration, you are using it in a greater volume so that it is staying in contact for a greater time. So you are doing the pre-endo buildup, you are using the rubber dam. Now these are how do you take your irrigant into the canal. All these methods are your conventional delivery system. I have my needle. Now relate to your clinical practice. How many of you are using such kind of needles? And to have more and more volume of your hypo, you are using a bigger syringe. Now, first change that you need to make, I'll request you to write it somewhere, because even if you are immediately not switching on to the negative pressure devices or techniques, at least make this smaller changes to give yourself a confidence for your endodontic for the root canal you are doing, and later you do an upgrade to the devices. The basic upgrade, the most basic upgrade you can do is you can switch to a 30 gauge needle. So you right now what kind of needles you are using, they are incapable of delivering your irrigant, whether hypo or EDTA, till your apical one third. So you need to use a 30 gauge needle. It is a thinner needle that is penetrating deeper into your canal space, delivering your irrigant to the most critical area. Now, what is the most critical area of your root canal system? Your apical one third is the most critical area. The reason being, your 90% of your anatomies, like your lateral canals, your isthmus or your apical delta, are in your apical one third. So what another thing I do, I don't discard my stoppers. Once my hand files are to be discarded, what I do, I keep the stoppers with me because I can use them with my needle. Okay. So that I am very well aware of the working length. Okay. So another thing, if you are using just with this thought that I'll be able to deliver more volume of my irrigant, you are using bigger syringes, it is of no use, because with the increase in the area, the flow, the pressure with which your irrigant is going inside the canal gets compromised. You need to have a good pressure for a good flow of the irrigant to happen. So another, go with the smaller syringes and a 30 gauge needle. Now, what these needles, these are your side vented needles. Okay, they are closed at the end and they are side vented. So when they are closed at the end, what they do, they don't let your hypo to go beyond apex. What will happen if your sodium hypochlorite is going beyond apex? You can have hypo accidents. That will be like that will be very harmful for the patient. So you don't want any irrigant, anything to go beyond apex. Okay. So you use close ended needles. And in case right now you are using what needles you are using, they are open ended. You always need to keep them at least 3 mm short of the apex, because your open ended needle, they deliver nearly 3 mm. See, my today's presentation is evidence based. Whatever I am telling you right now is not what opinions I keep or what I have experienced in my clinical practice. All the things that I am telling you are time tested, and there have been studies, handful of literature, where we have concluded that it is always better to switch to a 30 gauge needle if we want a proper cleaning of our apical one third. Always better to use a close ended needle if you don't want any hypo accident to happen. And this is one of the diagrammatic presentation to tell you, see what is happening if you are using a 23 gauge needle that you are right now using in clinical practice. You are preparing the canal by 2506. That means once you are inserting a 23 gauge needle, open ended needle into your canal, it will definitely be almost 4 mm short of your apical third. That is the area we really want to clean. Okay, so that will be your dead space. Your irrigant has not reached those areas, your irrigant has not cleaned those areas, your irrigant has not eliminated the bacteria that are present in the apical one third. Okay, so that is something you need to do. You need to use a 30 gauge side vented needle, 1 mm short, and to ensure that it is reaching deeper, you need to have a minimal apical size preparation of 30 to 35. Okay. Now, all these things that we have discovered are your conventional positive irrigation system. Okay. But even after doing so many things, using proper activation devices or techniques or intercanal heating or using 30 gauge needle, there are certain challenges that are still inevitable. Now, one of them is your apical vapor lock. What is happening when your tissue is getting disintegrated? There are several gases that are produced. What these gases they do, they block your apical one third. and once you are irrigating again, your irrigant won't be able to penetrate this apical vapor lock. So this is something that is happening which is not visible to our eyes, but it is there. There is a air, the proper entrapment which will not let your irrigant penetrate deeper. Okay, so this is one of the major challenge that can happen. And even if you are following all these protocols, still you cannot eliminate this air entrapment or your apical vapor lock. There are still chances for your, because it's a positive pressure irrigation system, there are still chances that your irrigant or your hypo can get extruded. And also there are areas that will still remain uncleaned. So to overcome those challenges, this was your positive irrigation. What is positive irrigation? You have put the irrigant into your canal, and that irrigant is coming out itself through the orifice, and then later it is getting suctioned out. Now, what is negative pressure irrigation system? See, you are able to do your irrigation and suctioning simultaneously, and at any point of time, your root canal system is not left without an irrigant. Every time there is fresh irrigant that is flowing into your canal space. It is getting suctioned there and then within the root canal system. Also, there is coexistence of your sonic activation. What is happening? Your irrigant is getting suctioned out. There is irrigation needle that is putting the irrigant inside. At the same time, the needle itself is performing your activation. So one such system that I have started using in my practice is from Epident that I'll be demonstrating. And another important thing is there have been a good amount of literature and data that is saying that the fluid dynamics, the irrigant that is going into the canal space is different in both our conventional lidl irrigation, which is based on positive irrigation system, and this negative irrigation system where the irrigant delivery and the irrigant suctioning is happening simultaneously. So how it is different is that your apical 1/3 is getting a better cleaning, and all at the same time, since there is continuous suctioning that is happening, it is not letting your hypo getting extruded. There are the studies, this was published in Journal of Endodontics, where they had compared a negative pressure device which is endovac, which that is also a negative pressure irrigation device, that there was a significant observation that the any kind of extrusion that was happening with the negative pressure device was way nominal, and also the disinfection that was happening was far better with the negative pressure devices that we are using. Now another thing that we have already discussed, if you go and read about how your hypo is dissolving your pulp, you will get to know that we need a continuous supply of sodium hypochlorite and a continuous refreshment of your sodium hypochlorite to get a better outcome that you get with the negative devices, because it is at every point it is suctioning your irrigant back. So let me show you what device it is. See, this is how you attach it to your chair side suction unit. So we are taking the irrigant. Okay. You have different kind of needles that are available for the interior and for the posterior. Also, you have flexible needles similar to Iriflex. Now, what you are doing, you are taking the apparatus, you are attaching it to the device. So you can achieve your simultaneous suctioning. Okay. So if you observe, there is a knob, this knob at the end. So when you are pressing it, you achieve a sonic activation. I hope you are able to appreciate the simultaneous suction that is happening. So this is the device that is on your right side. Okay. So this is how you attach the needle. I'll show you simultaneously if you are able to see it, or I'll demonstrate it. Okay. So this is the knob. So when you are pressing this knob, what will happen? You will achieve sonic activation with the needle. The needle again is a 30 gauge needle. I don't have to. Whatever we started with was important to tell you that how a small step when added together will give you a proper outcome. Like we needed rubber dam placement, because I know I'm using a hypo at a proper concentration, at a higher concentration. So I don't want hypo to go into the patient's mouth, because once the hypo is going into the patient's mouth, it is no longer hypo accident. It is your negligence, because it's going into the patient mouth because you were not able to put the rubber dam. Okay. Another thing, needle here also, the needle that is being used, there is a 26 mm needle for the interior. This one is for the interior. We have similar for the posterior that can be a little curved, that is again 30 gauge. And this knob, once we are pressing it, we are able to achieve sonic activation over here. And let me show you this. Okay. What I'll do is, first I'll complete my presentation so that I can stop sharing my screen. But so you can see the device right now, how do you assemble it and how do you use it, and how it is doing the activation of your irrigant. Okay. So again, I'll show you this. See, if you are able to appreciate here, there that even it is when it is suctioning out, it is taking all the debris out along with the irrigant when the irrigant is coming out. Okay. Okay. Uh, So there are, another important, since we are talking about disinfection only, we started with use of rubber dam for a proper asepsis. But another important thing is we have done all the protocols, followed all the protocols, and still we have not disinfected our gutta percha. It can still land us in a failure. So you have to disinfect your GP also. So with today's presentation, there are few takeaway points that I would like you to note down. That root canal anatomy is not simple. It is complex. It is very challenging. And it looks very simple on our x-rays. Like we have filled our 3 canals, 4 canals, but still there are areas that are inaccessible with our rotary files that can be cleaned, and proper irrigation can be achieved only if we are changing or advancing our irrigation, because your irrigation is the game changer. You need to upgrade in rubber dam. With rubber dam, you need to upgrade with different activation devices, sonic, ultrasonic. See, that is also debatable which is better. But if even if you are using a basic activation, like your manual dynamic, you're using your GP to activate, that would be sufficient, rather than using nothing, or rather than using your hypo at 3% or mixed with saline, that is no point. You have to use your hypo at full strength concentration. Another thing, using proper delivery system. You switching to a negative pressure will give you a better volume of irrigant reaching in the apical third, fresh hypo reaching in the apical third, continuous exchange of hypo in the apical one third, and simultaneous activation. So these are the key points that I want each one of you to note down. I would like to stop sharing my screen. If you want to connect with me, this is how you can connect, through Instagram or through my mail or my number. But I would like to stop sharing my screen now so I can show you the device over here. Hello, ma'am. So first of all, this is the device that is there. Okay. See, this is the device. Okay. So this is like simple, like the way you load your syringe, we are able to take the irrigant directly into this needle. Ma'am, is it visible? Ma'am, is it visible?
Yeah, it's visible. Maybe you can give a close-up view of the device, you know?
Yeah,
Please give a close-up
let's
view of
try
the
my
device.
best. Okay, so
Now
this
it's
is
visible. Hmm.
okay. This is the device. Okay, it is from Epident. Okay, okay. So this is the knob. When I am delivering my irrigant, I have to press it. So when I'm pressing it, what I'll do, what will happen? I'll be achieving activation with the needle. So you get pack of needles. Now right now, what needles I have is a 26 mm 30 gauge needle that is for interior, that we are using for the interior. Okay. So what I'm doing right now, I'm taking the irrigant inside. So how the activation is happening is because you have a battery over here. There's a battery that is giving you activation, and this is how you hold it. Now, see, once I want to attach it to my chair side suction, because we need to, it's a negative pressure device. So what we'll be delivering, unlike the conventional needle irrigation system, we are just delivering and the liquid is coming out into the chamber itself. Okay, we'll be having a simultaneous suction. Okay, simultaneous suctioning of your irrigant. So this is the apparatus that you put. So it becomes an assembly like this. Okay. This is the outlet where you can put you can insert your chair side suction. Okay. What I have done, I have actually colored my like this liquid right now so that you are able to appreciate the sonic activation that is being generated. Okay. This is the tube that you can attach to your chair side suction. Okay, directly attached to the chair side suction that you have, and you insert it here. There's a noise if you are able to appreciate it. There's a noise coming. Okay. So now it is attached to my chair side suction. My needle is there. This one is for the interiors. You have a if you are aware about Eriflex needles, that are the flexible one. They are also available. Okay. So I hope it is visible. I'm trying my best, okay? See, if you are able to appreciate the activation that is happening, are you able to? Or it's not?
Yes, there's some movement in the liquid that's visible. Maybe, yeah.
We did it.
Mm-hmm.
Basically, your activation, your delivery, and your suctioning, everything is coexisting. So you can remove it like this. You can easily get. It's a easy device. It's a very easy device. It's not complicated or there's no learning curve for it. You use it in one or two cases, you will be able to understand because your purpose is getting solved. Your activation is happening, your delivery is happening. What you need to do is change your needles. That's it. I just want make because I just want you to show another thing is that how the suction is happening. पेन को नीचे करना है, एक बार करो. Please focus over here. See, it's simultaneously getting suctioned. I'll again show you the activation that it is producing. I hope everyone was able to appreciate that. You can get a demo at your, like you can ask Mr. Harinder to provide you with the demo at your own clinic if you guys are interested. But Ma'am, I'm done with the demonstration.
Ma'am, you're on mute.
Ma'am, you're mute right now.
Okay, yeah. Am I audible now?
Yeah, yeah.
Yeah, so thanks a lot, Dr. Anu. It was truly an insightful and wonderful session on three-dimensional cleaning and how beautifully you have described each and every aspect. Especially, I would say to all the audience present here, like Dr. Anu has mentioned, apical one-third is the most challenging part of the tooth to be cleaned effectively. And trust me, guys, three-dimensional cleaning is something very, very important in endodontics. Endodontics is not completed without three-dimensional cleaning. And how beautifully she has mentioned that among all the irrigants which are available, what is the key ingredient, which is the key irrigant that we are supposed to use? That's sodium hypochlorite. And what are the advantages and drawbacks of sodium hypochlorite, and how effectively you can use hypochlorite in an efficient manner to achieve three-dimensional cleaning with a beautiful device like she tried her best to show, and it was a very nice demonstration, I would say, Dr. Anu, the way you
Thank you.
explained and mentioned about this device, how useful. It's a very economic device, among the world of expensive gadgets, I would say. It's a very nice and efficient device where you can achieve positive pressure irrigation along with aspiration in the same gadget, you know and besides, the device produces vibrations which helps to activate the solution. At the same time, the device can also be used for negative aspiration thing. So it's a pretty useful device, and we have Mr. Harind Verma from Epistate Health. He's there to help us. If you have any doubts, or if you want to study more on the device, or you want to have a demonstration, He has mentioned his number in the chat box below. You can contact him. Besides, we have Mr. Nihar and Mr. Harin both who are going to assist you in other products or if you have any inquiry. So, coming back to this presentation, again, a big thank you to Dr. Anu
Thank you for the
Vashisht.
opportunity,
It's
ma'am. I always look
our
up to
pleasure.
you.
It's my pleasure, dear. It was a beautiful and enriching learning session. And I'm certain, and I speak this to all of you, that when I say that you have made our Sunday exceptionally useful and productive, especially with your insights, your clinical tips and tricks that are going to be so useful in our routine clinical practice. And we are confident that applying these insights will definitely elevate our clinical work and help us to achieve the best possible outcome for our patients. Once again, thank you for your time, your wisdom, and inspiring. Just a minute, Dr. Anu. We have a
Yes, ma'am.
small token of appreciation from our side. Thanks a lot.
Thank you, ma'am. Thank you so much.
And
Thank you all. Thank you all, doctor.
yeah, and besides, you can all share your email ID in the chat box below. Like Dr. Anu has mentioned, and she was so generous to say this. If you have any doubts, you are free. You please feel free to contact her. You can also contact me if you have any doubts. Thanks again. Thanks a lot.
Thank you so much. Ma'am, I would like to say thank you to everyone who has joined today on Sunday. So, once again, thank you everyone for being there, for being very patient towards me, for listening me carefully. Thank you so much.
Thanks a lot,
Thank you,
guys. See
All the
ma'am.
you
best.
Thank you
All
for
the
the
best.
guys.
opportunity, ma'am. Bye
And
bye.
yeah, bye bye. And one more thing, please follow
Wait.
our channel, our account on Instagram, so you can have more idea about these short seminars which are going to come up because we share information on the Instagram account and social media Facebook account as well. Thanks a lot. Thank you so much.
Thank you, ma'am. Bye
Thank you,
bye.
guys. Bye. Have a happy Sunday. Bye.
You too.
Bye.